Oh yeah, we're good. This thing is crazy. Okay, come on. Is it gonna work? Nope, not gonna work. Oh well, it's okay. Hi.
Hi.
Okay, so what we're gonna do for our first exercise is lay up against a wall, and you're gonna get a yoga
Block?
block. I'll just use something like this. And the reason I have you set up like this is because if you don't have the available dorsiflexion to do this exercise, then that wall is gonna kind of push on your foot. And so this is a nice thing to do, is to set up like this. And the other thing you can do is put a towel under your heels to kind of give you a little softness in your heels, because what we have on the table is your heels are off the table, so it's not driving up into your feet, the table itself. Does that make sense?
So my heels were off the table when I did it because it was into your hand.
You got it. So if you have a towel under your legs, it'll kind of deload you a little bit so that the floor isn't driving your heel up. And that'll soften you a little bit and then allow you to find this better.
Okay.
So what you're gonna do is think about the left rib cage and that left anterior tissue pulling this way to drive your heel that way.
Yeah.
It's a push-pull system like that.
So the ribs going up kind of and the heels going down.
The ribs are actually closing.
The ribs are closing.
Yeah, so it's pulling everything together like that.
Okay.
Yeah, it's almost like hoisting the pelvis up with the front side tissue. So that's one way you can do that with an isometric.
Okay.
The other way is right here. Same deal, same targeted area, but it's gonna put your knee in a different configuration, more of a hip flexed, which is gonna change the response.
And I don't even have to have my feet up against something there, right? They can kind of, it can
Go
be like a free.
Yeah, you can go knees bent. Like are you saying like this?
Or, well, yeah, I guess.
Or like this, is that what you're saying?
I guess I wouldn't do that probably because I'm paralyzed. Could I do it with, we want both legs in the same position, right?
Yeah.
So I guess I could either do that or hook line and just play with it and see what's
You
more
can go hook
comfortable?
line too, for sure. Yeah, this, for some reason, like I like the feeling of being kind of in this thing. Here, my line of force feels less targeted to the frontal plane.
Okay.
And that's kind of my rationale for going here, because I'm thinking it's going this way versus here. I'm like, what am I doing? But yeah, I think either way would just be fine, but I would probably start you out here. And I'm just resting on the wall. I'm in a very relaxed, comfortable position, and I'm contracting here, and I'm just feeling the result of this.
And mainly you're looking, you're imagining kind of there's a gap, like this is opening up that gap right there, kind of.
Yeah, it's kind of driving everything down.
Yeah.
Yeah. Which is kind of weird because I wouldn't think about this too hard with the gap situation, because if you, but just I would focus more here on this zone here. Yeah. Cool. Okay. Any questions on that?
Awesome. Is it okay to check the plantar and dorsal real quick?
Let's check it.
Okay. Just curious.
Yeah.
So we know like right away what we did and didn't